Order. In the absence of a gavel, I'm banging on the table here. So there we go. Some housekeeping things first here. As the hearing is fully virtual, we need to address some of these issues. For today's meeting, the chair or staff designated by the chair may mute participants' microphones when they are not under recognition for the purposes of eliminating inadvertent background noise. Members are responsible for muting and unmuting themselves. If I notice that you have not unmuted yourself, I will ask you if you would like the staff to unmute you. If you indicate approval by nodding, staff will unmute your microphone. I remind all members and witnesses that the 5-minute clock still applies. If there is a technology issue, we will move to the next member until the issue is resolved, and you will retain the balance of your time. You will notice a clock on your screen that will show how much time is remaining. At 1 minute remaining, the clock will turn yellow. At 30 seconds remaining, I will gently tap the gavel to remind members that their time is almost expired. When your time has expired, the clock will turn red, and I will begin to recognize the next member. In terms of the speaking order, we will begin with the chair and ranking member, then members present at the time the hearing is called to order will be recognized in order of seniority. And finally, members not present at the time the hearing is called to order. Finally, House rules require me to remind you that we have set up an email address to which members can send anything they wish to submit in writing at any of our hearings or markups. That email address has been provided in advance to your staff. With that, I want to acknowledge Ranking Member Cole and all of our colleagues joining us as we come together to discuss the COVID-19 pandemic and the child care crisis. Let me also welcome our witnesses this morning. Melissa Boteach, Vice President, Income Security and Child Care Early Learning, National Women's Law Center. Georgia Goldberg, Director, Hope Child Development Center. Dr. Teresa Hawley, First Assistant Deputy Governor, Education, Office of Illinois Governor J.B. Pritzker. Dr. Catherine Stevens, Visiting Scholar, the American Enterprise Institute. We'll provide more fulsome introductions before their testimony, but we are so glad that you all could join us this morning. Thank you for the work that you do every day. The fight for childcare is such an important one, but it breaks my heart that it has to be a fight at all. I have said time and time again that the United States has been teetering on the brink of a childcare crisis, but now this COVID-19 pandemic has pushed us over the edge. Even before the pandemic began, affordable child care was already a significant and a severe issue. Now this pandemic has further exacerbated and exposed existing disparities. Women, particularly women of color, have been disproportionately impacted by this crisis. The National Women's Law Center reports that since February of last year, women have lost over 5.3 million net jobs and account for 53.8% of overall job loss since the beginning of this pandemic. Recent data on job losses also revealed that employers cut 140,000 jobs in December. Every single job cut belonged to a woman, and mothers with young children were hit particularly hard. While this was an issue, as I said before the pandemic, COVID-19 has intensified these problems, again, especially for women of color. Part of this has to do with childcare. Lack of childcare has been cited as a reason why women are still highly reflected in the unemployment numbers. And according to Ms. Boteach's testimony, and I quote, approximately 32% of employers said that they had already seen employees leave since the pandemic, and half of those cited childcare as the reason. To be clear, women are not opting out of the workforce, but rather they are being pushed out by inadequate policies. We have a real opportunity, not just to throw money at the problems, but to build the architecture for the future and use this as a moment to address these serious inequities that have been further exposed by the coronavirus pandemic. Because it is unconscionable that each day hardworking women, mothers, and families have to make a choice between going to work and ensuring that their kids are properly cared for. For those parents who are essential workers or who need to work in order to pay for childcare, this is an all but impossible choice. Childcare providers, the overwhelming majority, over 90% of whom are women or people of color, have been operating on razor-thin margins if they have been able to stay open at all. Their wages are minuscule. They've grappled with changing health and safety procedures. And as the bills continue to stack up, many have had to close their facilities, whether temporarily or indefinitely. Others that have stayed open have fewer children, either because parents are concerned about exposing their kids to COVID-19 or because they have lost their incomes. These woes are further complicated by rising costs for childcare providers as they scramble to provide PPE, to sanitize their classrooms, to secure more space for social distancing. As a result, many of these small businesses and their owners are finding themselves on the verge of collapse. We need to save the childcare industry. It is not just a matter of economics, it is a matter of priorities. It is a matter of right and wrong. In my home state of Connecticut, we have more than 121,000 children ages 5 and under who need childcare. But without adequate support from the federal government, Connecticut could lose about 48% of the childcare supply, more than 46,000 licensed childcare slots. It was already the case that for every one childcare slot lost, there were 2 children in need. Now it is more than 4. The crisis has become a catastrophe. Thankfully, our country is waking up to the reality that childcare is essential for women, for children, for parents, for small businesses, communities of color, and for our economy at large. To chair the subcommittee, I've been working for quite some time to draw attention to the impending childcare crisis. It's critical for Congress to do more to ensure programs like the Child Care Block Development Grant receive the funding they need. As you will recall, Congress appropriated $5.9 billion for Child Care Development Block Grant in 2021. In addition, $3.5 billion was included for CCBDG in the CARES Act, and an additional $10 billion in December in the supplemental. To be frank, the funding not nearly enough. Just as we provided grants in the CARES Act through the Payroll Support Program, so airlines could pay their employees and keep flying through this pandemic. We support that effort. We must also do what is necessary to get our economy back on track by rescuing the child care industry. We provided over $648 billion for the Paycheck Protection Program to get small business owners back on their feet. It was a good thing to do. We need to do what's necessary to stabilize the child care industry, to allow parents and caregivers to get back to work. One of our witnesses, Melissa Boteach, will discuss a little more in her testimony that child care is the work that makes work possible. So if it's true that the child care industry makes all other work possible, then why have we provided only $13.5 billion in supplemental funding to the CCDBG? If child care providers are essential workers, then why aren't we treating child care work as essential? $13.5 billion is not enough, which is why it is crucial that we act, and we act quickly. At the end of the day, if we cannot make families feel that their kids are going to be safe, secure in their child care setting, then we cannot build a feasible path to a recovery. With that, let me turn to my friend and my colleague from Oklahoma, the ranking member, Congressman Cole, for any opening remarks he may have. And I will ask those who are not speaking to please get yourself on mute so we can move forward. Congressman Cole.
Thank you very much, Madam Chair. Before I begin my formal remarks, I just want to say what a pleasure it is to have you once again as our chairman of this subcommittee, and more importantly, as the chairman of the full committee. I think I can speak for people on both sides of the island that we think this will probably help us a lot in our allocation requests going forward. While as a Republican, I certainly was not in a position to vote for you once it was clear we were going to be in the minority. I think it's fair to say I was ahead of the Republicans for Delora effort. So I congratulate my colleagues on the other side of the aisle of making a very wise choice to chair our full committee, as well as obviously your decision to remain as our subcommittee chairman here on Labor Age. I really am grateful for both those things. I want to begin, Madam Chair, our first hearing in the 117th Congress by reiterating my commitment to working with you whenever we can to find common ground on what looks to be yet another very challenging year. We will have our work cut out for us, but our 6 years of working together has laid a good foundation. Just last year, we were able to come together and pass not one, but 5 coronavirus supplemental appropriations, and from the standpoint of this committee, I think even more importantly, a full year's appropriation for this bill. This serves as a testament to what this institution can achieve together, even in a divisive political climate. And I certainly hope we can continue those efforts, and I'm sure you do as well. I also want to welcome back to our subcommittee, Mr. Fleischman. He's been a strong member of this committee in the past, and we're very glad to have him return. I'm sure he'll make an exceptional contribution to our deliberations. I would also like to acknowledge our newest member on our side of the aisle, Mr. Klein from Virginia. We look forward to working with Mr. Klein and the new perspective that he will bring to the subcommittee. I'll also just report he's been known to smoke an occasional cigar, so he's apt to be one of my favorite new members, Madam Chair. And now to turn to the topic at hand today, the impact of the pandemic on the child care industry. The economic shock our nation experienced in the spring of this last year was unprecedented. Real gross domestic product declined at an annual rate of over 30%. Our lives were completely upended. While almost no industry was spared from the economic fallout, the child care industry was hit especially hard. Much of the industry had to close completely for large portions of the year. And even those who were able to remain open sometimes had the capacity of no more than a quarter of what it was in the prior year. Thankfully, in the first weeks of this year, we're continuing to see an economic turnaround. In many respects, the economic rebound of the last few months is unparalleled. However, not everyone has been fortunate enough to see their situation improve, and we continue to hear stories of too many families struggling. To address the pandemic's consequences, Congress provided nearly $700 billion in supplemental appropriations, accompanied by hundreds of billions of dollars more from other mandatory entitlement extensions. Of the appropriated dollars, an overwhelming 63%, or $434 billion, was for this subcommittee, with $13.5 billion exclusively to support child care access for low-income families. The last supplemental passed just a few weeks ago included $10 billion to support this critical industry to aid our continued economic recovery. I've been proud to support all of these bills and believe they've done much to ward off what could have been an even more severe economic fallout. Prioritizing funding for child care and providing options for parents to get back to work has been something both Republicans and Democrats have been able to support. I think in addition to ensuring child care options remain available to parents, we also need to ensure our public schools begin opening their doors to students. There's no substitute for in-person learning. As we consider additional resource needs, I hope we can also focus on reopening our public schools. As we look towards industries still in distress, we need to allow the resources appropriated just a few weeks ago to make their way into our local communities. I believe we need to see who is still being left out of the recovery and tailor future efforts for those who truly need it. The pandemic has shed light on gaps in data and national statistics. In many cases, we still lack the information needed on how to target relief to achieve maximum benefit. There's also increasing concern that we are no longer focusing on families in need of assistance, but providing subsidies to the well-to-do who do not need it. I hope we can address those questions today. But I want to thank our witnesses for volunteering their time and their expertise. I had the opportunity to read their excellent testimony last night, and I look forward to hearing each of your recommendations this morning. And with that, Madam Chair, I yield back the balance of my time.
Back, obviously excited to chair the full committee, but as you have noted in the past, the former chair of the committee, Congresswoman Lowy, this subcommittee was near and dear to her heart, as it is to mine. I'm also hopeful that our opportunities together will increase the allocations that we get. But I want to just say, you know, oftentimes people will say to me, why can't Democrats and Republicans get along for the common good? And Congressman Cole, I cite the relationship that we have. And as you pointed out, we do have differences, and that is to be anticipated. But it is that common ground in that belief of knowing and understanding why we serve, as you do, that our job here is to try to affect differences and hopes in the lives of the people that we do represent. And that is critically important to me. And I cite our relationship as the example of, in fact, that is what we do every day, is to try to work together in these efforts. And I also want to welcome Congressman Fleischman back. We co-chaired for a while the Baby Caucus. And so his interest in children and families is well known. And to Congressman Klein, it's wonderful to have you. And I was remiss in my opening remarks not to recognize our newest member of the committee, and that's Congresswoman Brenda Lawrence from Michigan. It was on Labor HHS, and you should know in the organizational meeting, in order to get on this committee was really very interesting. No one knew what she was going to do. She threw in all of her committee assignments that she had, and so that when it came round, this is what this Labor H is what she selected. So that tells you about her commitment to the issues that come before this subcommittee. And with that, let me again welcome and introduce our witnesses. Melissa Boteach, Vice President, Income Security, Child Early Learning, Child Care and Early Learning at the National Women's Law Center. Georgia Goldberg, Director of the Hope Child Development Center, and one of my constituents. I have been to the Hope Development Center, and Georgia has been doing an amazing work, and you'll hear her fighting on the front lines for child care providers in the district. It's really a steadfast dedication to our nation's kids and their families and workers. It really is beyond compare. And I know we all have examples of the Georgias in our own communities, but I single my Georgia out here for efforts as well. And I think, where's Josh? Is Josh Harder there too? Josh? Anyway, new to our committee, and I'll talk more about Josh in a little bit. Dr. Catherine Stevens, a visiting scholar from the American Enterprise Institute. And Dr. Stevens, I don't know, it said you taught in the schools in New Haven. So I would love to know what schools you taught at. I'm a townie, born and raised in the city of New Haven. So anxious to find out where you taught in New Haven. And now I would really like to yield to Congresswoman Bustos of Illinois, who will introduce Dr. Hawley.
All right, thank you so much, Chairwoman DeLauro. Am I audible to everybody? All right, thank you. And let me just start out by saying how much that I appreciate you, Chairwoman, your leadership on this issue, and for inviting Dr. Hawley from the state of Illinois, my home state, who I very much am proud to introduce. Dr. Teresa Hawley serves as the first Assistant Deputy Governor for Education in the office of Illinois Governor J.B. Pritzker. She supports state education agencies and initiatives birth through college, so a wide range of responsibilities. Dr. Hawley has nearly 3 decades of experience in developing programs and systems that support the school readiness and healthy development of young children in poverty. Most importantly, for the sake of this hearing today, Dr. Hawley leads the state's early childhood response to the COVID-19 pandemic. She's been at the forefront of Governor Pritzker's great work that I am so proud of, where they are supporting families and child care providers during this very, very difficult time for families all over. With the help of the CARES dollars, Illinois was able to provide grants to nearly 5,000 child care providers across 95 of our state's 102 counties. This helped, get this, 3/4 of these grantees cover as much as half of their expenses. And these grants also helped the child care providers retain more than 8 out of every 10 of their employees that they had before the pandemic. So this funding and other great work really kept the child care operations in our state open, kept staff employed, and gave families options during these very difficult times. So I want to just say thank you to Dr. Hawley for being here today. Welcome to her. And I very much look forward to your testimony, as I know the rest of our committee does as well. Thank you so much for your great work. Thank you, Madam Chair. I yield back.
Full written testimony will be included in the record, and you are now recognized for 5 minutes for your opening statement. Ms. Boteach.
Good morning, Chair DeLauro, Ranking Member Cole, and other distinguished members of the subcommittee. My name is Melissa Boteach, and I'm the Vice President of Income Security and Childcare Early Learning at the National Women's Law Center. We are here today because America faces a childcare crisis, one with far-reaching and devastating effects for children, for families, and for the economy overall. As of January 2021, half of the 350,000 childcare jobs that were lost at the onset of the pandemic had not yet returned. The National Association for the Education of Young Children surveyed over 6,000 providers in December of 2020. Nearly half reported that they knew of multiple centers or homes in their community that had closed permanently. 44% reported confronting so much uncertainty that they are unable to say how much longer they can stay open. These numbers are a call to action. In addition to being crucial to children's development and a vital support for parents, childcare is infrastructure. It holds up our economy. It bridges workers and jobs. And like physical infrastructure, care infrastructure makes all other jobs possible. My testimony today will address how we got here, the effects of this crisis, and solutions to build a stronger childcare system. Even before COVID-19, America faced a quiet childcare crisis. Families were struggling to find and afford childcare, with fewer than 1 in 7 eligible children served by federal childcare programs. Nearly half of Americans lived in a childcare desert without sufficient supply. Early educators, who are virtually all women, and disproportionately women of color and immigrant women, were paid poverty wages, with over half relying on public assistance. These trends are no accident, but rather rooted in a racist and sexist history of undervaluing the care work done by women, especially Black women, Indigenous women, and other women of color. Into this fragile system, COVID-19 was the perfect storm. Today, childcare providers that are open are going into debt to operate safely, paying more for staff, cleaning supplies, and PPE, even as their revenues are down. Thousands have shuttered, many permanently, due to the increased cost of operating in a pandemic paired with the reduced revenues from under-enrollment. And the sector's collapse has had far-reaching consequences for families and for the economy. First, women's employment gains are being set back a generation. Just prior to the pandemic, we celebrated women comprising half the workforce. Fast forward, and last month alone, 275,000 women left the labor force, bringing the total number since the start of the pandemic to over 2.3 million women compared to 1.8 million men. These women are not dropping out of the labor force. They are being pushed by our lack of care infrastructure, with long-term consequences for their families' income and retirement security. Second, when our care infrastructure collapses, children pay a price. Children of all ages feel the strain of parental stress and lose out on the educational opportunities that high-quality childcare can provide. Finally, our lack of care infrastructure undermines our economic foundation. The Century Foundation and Center for American Progress estimate that the risk of mothers leaving the labor force or reducing work hours to assume caretaking responsibilities could amount to more than $64.5 billion per year in lost wages and economic activity. For context, that's more than the cost of legislation to provide high affordable childcare for all. So where do we go from here? First, we must swiftly pass the American Rescue Plan, the minimum required to provide settings that are open with the resources to operate safely, ensure fair wages and protections for childcare workers, stabilize childcare businesses to ensure that they can still be there when the economy reopens, and support families with lower co-payments and expanded eligibility. Second, increased and robust funding for childcare and early learning programs in the fiscal year 22 appropriations would provide states with greater certainty, allowing them to more strategically spend relief dollars without fear of facing steep budget cliffs. Finally, while stabilization is urgent, the goal is not to return to an equitable pre-pandemic status quo. Instead, we need to build toward quality, affordable, accessible care for all families that meets their diverse needs, along with those of a well-supported workforce. Inclusion in future jobs and recovery packages will be crucial for this goal. The COVID-19 pandemic has laid bare and exacerbated longstanding inequities in our nation's childcare system and presents us with a stark choice. Do we watch a childcare crisis unfold that has set women in the workforce back a generation, compromised children's development, and harmed businesses? Or do we invest in childcare as a public good, laying the foundation for stronger families and a stronger economy? As Congress considers funding for relief, appropriations, and recovery, I urge you to choose investment in childcare. You're
There we go. I said thank you for keeping it under 5 minutes. I got to get myself together here. I'd like to introduce our next witness, Ms. Goldberg. Full written testimony will be included in the record. You are now recognized for 5 minutes for your opening statement. Thank you.
Good morning, all. And if you would just indulge me for a quick second to say, and this is simply fact, it's not an opinion, that I have the best representative in the entire world. And I would just want to say that, not to diminish anybody else, just facts. Chairwoman Delora, Ranking Member Cole, and distinguished members, thank you for the opportunity to provide testimony on the challenges confronting the childcare industry because of COVID-19. My name is Georgia Goldberg, and I've been a director of Hope for New Haven for 15 years. Hope for New Haven is a faith-based nonprofit located in New Haven, Connecticut, and manages the Hope Child Development Center, a licensed 77 capacity facility serving children 6 weeks to age 13. I'm also the co-founder of Circle, a network of 80 childcare providers in the greater New Haven and Bridgeport area serving children and families of color. Early in the pandemic, our organization assessed our options with our staff after the abrupt closure of the Paycheck Protection Program. Hope went from serving 75 children to 25 in a matter of days when the city and the state went into lockdown. After laying out several possible options to our staff, they unanimously agreed to work on a part-time basis to ensure that the center remained open for families. This proved to be a critical lifeline to families like Little G's, whose mom had been out of work for 5 months, searching for a program that was not only open, but also equipped to deal with his complex medical needs, not limited to a cerebral shunt and a feeding tube. Our parents, our families, our children need us became the industry's organizing principle because we deeply understood not only how critical our role played in undergirding the economy, but also how short-sighted policies and structural inequities due to chronic underfunding and benign neglect left the industry particularly vulnerable to this pandemic and threatened our very capacity to respond to the COVID crisis. And as I watched our industry step up to support our nation from our long beleaguered economic hurt, My lament was not how broken the system was, but rather how efficiently and consistently this broken system continues to undermine women, the poor, and most especially people of color. This was most pronounced in the SBA's EIDL and Paycheck Protection Program, which, because of the financial nature of the childcare industry, effectively sidelined many providers from consideration in these programs. According to a survey conducted by the National Association for the Education of Young Children, 75% of family childcare businesses did not secure any funding through these programs in the first stimulus round, a fact that is borne out by our experience and reporting from our state's staff family childcare networks. In fact, this year, Circle recently helped a family childcare provider apply for over $10,000 in PPP funding, an amount she did not know she was eligible for last year. Furthermore, the industry's effort to reopen and to remain open continue to be stymied by critical staff shortage due to low salary potential, ballooning expenses, and low enrollment. All these act to form a perfect storm around the industry that will result in catastrophic loss of programs like Hope. In Connecticut, 15 to 20% of centers and family group homes and a staggering 80% of license exempt programs remain closed as of today. The fear is that these closures will be permanent and the numbers will mount. Former Treasury Secretary Timothy Geithner, in reflecting on the U.S. response to the 2008 financial crisis, said the failure was not acting early enough to reduce the risk of the existentially damaging event that seems remote and implausible. Sadly, we are at another such crossroad. The childcare industry, like the banks in '08, is on the verge of collapse. It is not hyperbole or a partisan talking point, it's a fact. And if we fail to act once more to an event that for some may seem remote and implausible, unlike the 2008 crisis, the cost will not be measured in dollars and cents. Thank you so very much for your time.
Um, Again, thank you very, they keep muting. What's happening here? Hold on. Okay. Whoa. All right. I'd like now to introduce Catherine Stevens. Catherine, where did you teach? Can,
Yeah, Lila Day Nurseries.
oh, for my gosh sakes, I know it well. Been there many, many, many times in the East
Wonderful
Rock
place.
area. It's great. It really is a great place, right? Great reputation. And they've been there for years and years and years. Thank you. Please go ahead. You're recognized for 5 minutes. Thank you.
Chairwoman Delora, Ranking Member Cole, and distinguished members of the subcommittee, thank you for the opportunity to testify today on the crucial issue of high quality care for young children. My name is Catherine Stevens, and I'm a scholar at the American Enterprise Institute, a nonpartisan think tank where I focus on the science of early development and its implications for how policy can advance the well-being of all our nation's young children. The views I offer today are mine alone. It's a huge step forward that it's now so widely recognized that children's earliest years are critical to their long-term health and well-being. Yet, as the other witnesses have emphasized, a large number of the most vulnerable children still lack access to high-quality childcare, even as research is crystal clear that the quality of care matters for exactly those children the most. As a result, healthy development of lower income children in poor quality childcare is compromised. At the same time, workforce participation among parents who are unwilling to put their children in substandard care is greatly constrained. This is an emergency affecting millions of disadvantaged children and their families. CCDBG targets lower income working families earning under 85% of their state's median income, currently averaging $77,000 a year for a family of 4. But many families who need subsidies do not get them. And for those who do, subsidy amounts in almost all states fall far short of what's needed to access the high quality care that wealthier families are already using for their children. The bottom line is that too many low income working families greatly need help they aren't receiving. But the child care plan that's been laid out is not targeted to either the providers or the families who are truly struggling, while it disproportionately benefits much more affluent families. Even more worrisome to me, it's based on a deeply flawed assumption that it's developmentally optimal for all young children to spend a large proportion of their earliest years in out-of-home care. As I explain at greater length in my written testimony, I have 3 additional concerns about this plan. First, as I've said, lower income working families' access to high quality care has long been inadequate, which has been hurting many families and their young children for years. But according to the most recent reliable evidence, no extreme pandemic-caused crisis in childcare for young children really exists. Studies show that, in fact, the primary crisis working women are now facing is due to school closures, not a lack of childcare for children under 5. Second, establishing special childcare stabilization funding separate from CCDBG accomplishes no unique ends with respect to stabilizing childcare. What it will do, though, is diminish state leadership in early childhood while creating whole new state-level administrative entities directed by the federal government and focused on building the childcare industry rather than meeting the critical needs of families and their young children. Finally, this plan is presented as an emergency response to fallout from the pandemic. That's a misrepresentation, though, because its primary aims are to advance a long-standing advocacy agenda. The plan aims to leverage pandemic relief funds to carry out a kind of trial run of universal childcare while laying substantial groundwork for a major permanent expansion of government-funded non-parental care. In closing, I would like to make one final point. A large number of adults have become increasingly enthusiastic about expanding childcare to all young children for reasons you already know. Of course, the economy matters. Of course, women's careers matter. But what matters most of all is the well-being of young children. Our growing assumption that long hours in childcare has no negative impact on them is incorrect. We need to think much more carefully before taking the enormous step towards promoting institutional care for all young children that this legislation is proposing. I know that some object to the plan because of its cost. That is not my primary concern, though. My primary concern is the well-being of our nation's young children, and I urge you to reconsider this plan for their sake. Thank you again for allowing me to provide testimony before this committee on such an important topic, and I look forward to your questions.
Thank you very, very much. Now, next witness is Dr. Hawley. And Dr. Hawley, your full written testimony will be included in the record, and you are now recognized for 5 minutes for your opening statement.
Good morning, Chair DeLauro, Ranking Member Cole, and other distinguished members of the committee. Thank you for inviting me to speak today. My name is Teresa Hawley, and I serve as First Assistant Deputy Governor for Education for the state of Illinois. I work with an incredible team in our governor's office and state agencies to support education birth to college, and as such, have a unique perspective on how the pandemic has impacted early childhood education and care compared to K-12 and higher ed. I want to share with you some of our experiences over the past year. In March 2020, we required childcare centers and homes to be closed except to serve children of essential workers. This posed a significant financial burden on providers whose business model relies on per-child tuition revenue. We moved quickly to use our CARES Act Child Care Development Block Grant funding to minimize revenue losses for centers and homes in our subsidy system and to offset some of the increased costs of providing care for our emergency child care providers. Because only about 40% of care in Illinois is subsidized, we knew that many providers wouldn't benefit from our subsidy-focused policy changes. So we partnered with philanthropy to help providers access other federal relief funding, like the Paycheck Protection Program and the Economic Injury Disaster Loans. In April, The governor's economic team was working with leaders across industries to develop health and safety guidelines for their reopening. They heard from employers over and over, what's going to happen with childcare? Our employees won't come back unless childcare is available. With an estimated 15% of the workforce needing childcare to work, we needed our childcare programs to reopen. We worked with public health experts and childcare providers across the state to develop our reopening health and safety guidance, which included having fewer children in each classroom and avoiding the combining of classes at the beginning or end of the day. This meant providers would continue to experience reduced revenues and increased costs. According to our cost models, we estimated the overall loss for childcare providers in Illinois to exceed $50 million per month. Meanwhile, federal relief from PPP had run its course, and providers were reaching out telling us they were afraid they were going to have to close their doors permanently. The financial impact on childcare providers and the potential impact of childcare shortages was part of every discussion our team had on reopening the economy. In our state budget passed in May 2020, Governor Pritzker and our General Assembly stepped up and devoted $290 million from the coronavirus relief funding to support childcare. We quickly designed the Child Care Restoration Grants Program to stabilize and reopen childcare programs and had applications available by mid-July. We collected extensive input from providers and used cost modeling to develop a funding formula for the grants to replace the substantial proportion of providers' lost income. Our formula was designed with equity in mind, giving an extra 10% to programs in disproportionately impacted areas with COVID-19. These grants were well received. Nearly 5,000 grants were distributed all across our state to over 2,000 centers and nearly 3,000 family childcare homes. Grantees overwhelmingly reported that the grant met their needs and kept them afloat July through December. Unfortunately, our Child Care Restoration Grants funding was exhausted by December. Providers have told us they still need this funding for their business to survive. Their enrollment is still about 30 to 40% lower than before the pandemic, and they continue to suffer significant revenue shortfalls. We plan to use most of the recent CCDBG relief funding to extend our grant program, but the funding will not extend as long as we know it will be needed. Without additional funding, we'll have to give providers so much less than we can see they need. We support the child care funding in the American Rescue Plan, and we know we will be able to put it to good use. The pandemic has shown how fragile our child care system is because of how it is funded. As I mentioned, I also work on K-12. There have been huge financial implications of the pandemic there too, but at least we were not worried that a large percentage of our public schools might permanently close their doors because of the financial shock. Childcare is critical infrastructure for our economy and a crucial component of our education system. We need to fund it as such. We need a substantially larger, long-term, stable commitment to funding high-quality early childhood education and care to ensure affordable access for every family that needs and wants it. I urge the subcommittee to support this critical investment in America's future. Thank you.
Thank you very, very much. And to all our witnesses, I think from both sides of the aisle, this has been a stellar group of witnesses who have kept their remarks under 5 minutes. So thank you all very, very much. And we'll move to questions. I have 3 questions that I would like to get into this first round. So I will be brief, but I want to just I want to start with you, Ms. Goldberg. How has low enrollment in child care centers impacted day-to-day operations and child care survival as a small business? You need to unmute. Can someone unmute?
I've got it. Thank you. For Hope Child Development Center, we need at least 70 children just to break even. We have been languishing at around 45 to 50 children each month. And so if we are seeing about a $20,000 loss each month in our budget, and I cannot tell you what that will mean for our program. We are pretty close to exhausting all of our resources. And so for us, it is just creating a situation where it's a day-to-day wondering which day is it going to be when we have to close our doors permanently.
Mhm. Okay. Dr. Hawley, how do you see efforts to stabilize and invest in childcare as investments in the broader labor workforce? Why does the Congress need to step up and invest big so that we can do more in Illinois and we can do so that in other states can follow suit with the kind of program you put together in Illinois?
So as the other witnesses have attested to, if parents don't have a safe place for their child to be during the day, they're not able to go back to work. And so we heard, as I said, over and over again from all of the industries in the state, they saw the importance of childcare as undergirding the economy and undergirding the employment of the ability of their employees to come to work. And so we know that investing in childcare as a stable, with a stable funding stream that keeps it open and keeps it available and high quality for families is absolutely critical.
Let me also now ask Ms. Boteach. The Law Center has published a report on the different ways states are trying to reach child care providers, help them through the crisis through supplemental funding. But it's not enough. Can you explain some of the things that states are doing that have been particularly effective? And then how vital is it that Congress pass the $40 billion in funding that is part of President Biden's American Rescue Plan?
Absolutely. So as evidenced by Dr. Hawley's presentation, Illinois is one of the states that's really taking the lead in terms of thinking about how we use the CARES money and other money. But other states as well have thought about how they give grants to childcare providers so that they can deal with the increased costs, such as PPE, sanitation equipment, and also the cost of substitute pools and things like that for when providers get sick. Others have talked about how they make sure that there's premium pay because the childcare providers are frontline workers. They're risking their health and in some cases their life in order to serve frontline workers. And so being able to provide premium pay and other things like that is something that's important in order to retain the workforce. And then finally, some states have also been able to use the funding to help parents afford care more by either expanding eligibility or lowering co-payments.
Let me just, when it comes to which workers decide to return to work, how heavily is that decision based on their child care needs? Do you have information about that?
Yes. So there's not a there's not a survey that says I left work because of the childcare needs, but you can look at the data and you can figure out that, for example, in September, when there was a return to distance learning, 4 times as many women as men dropped out of the labor force. A Center for American Progress analysis of the most recent BLS or Bureau of Labor Statistics data found that there were 700,000 fewer parents with a child under 5 in the labor force than there were 1 year ago. And so these interruptions are not hitting mothers and fathers equally. And as Dr. Hawley testified, hundreds of thousands of working parents will need affordable, high quality childcare before they can even begin to look for a job coming back as the economy reopens. And we know that once a parent exits the labor force, it's much harder to re-enter it, which has long-term consequences for women's financial security all the way up into retirement.
Okay. Thank you. My time has expired, and let me recognize
Thank you very much, Madam Chair. If I can, I'm going to go to Dr. Stevens. And, there's no question, I think, that this committee wants to provide additional support for the child care industry. We've done that in the coronavirus bills in the past, and we recognize that's important. But part of the problem is figuring out exactly why somebody left the workforce. We have a group of people that left, honestly, not because of childcare needs, but because their jobs disappeared. That's particularly true in the hospitality industry, the leisure industry, the travel industry, disproportionately, probably lower income, disproportionately people of color. So that's one group. Then we have a group that clearly left because they did not have childcare options, either because the centers they sent their children to no longer had sufficient space to handle them or were going under financially. So that's a second group. And then there's a third group that left because of child needs, but was related mostly to public school closures. And I suspect, as you mentioned in your remarks and your written testimony, that's a very large group. Do we have any data that suggests what the proportions are? Because one of our big problems as a subcommittee will be, where do you target available funds? I mean, how much should go to which groups in order to help people return to the workplace while making sure that their children have adequate care?
Thank you for that question. Yeah, I think there's no doubt that the current childcare crisis is caused by school closures. There was a University of Chicago economist did a study last spring using Census Bureau data to analyze how many workers needed childcare to go to work, meaning children under age 14. That was their assumption. What they found is that 24 million workers, 15% of the workforce, have school-age children, meaning they're not going to, they need to do something with their kids if the schools are closed. 17.5 million workers had children under age 6. However, about 20% or 15% of those children are 5-year-olds. They were economists, they weren't thinking about the school system. So those kids are actually school-age kids, so they're affected by school closures. And under half of children under age 5 are in childcare in the first place. And childcare has reopened, as nearly as we know. No one seems to have very good data on this, but it's reopened at a much faster rate than schools have. So at the time they did this study, less than 5% of the workforce requires childcare to go to work, childcare for young children, while 15% of the workforce requires school care, if you want to put it that way, to go to work. So I want to emphasize that I think the question that I and the other witnesses have emphasized in terms of the access to high quality care of low income children, that is something that I know you're concerned about. I know the committee has addressed. But if we're talking about the child care crisis caused by the pandemic, that the primary driver of that is the school closures. I think you're on mute.
Thank you very much. I want to stress again, our aim here isn't to create an either or situation, but just what's the appropriate targeting of the resources that we have. Let me ask you a second question, which you touched on and certainly talked about in your testimony and in your written testimony, and that is this idea of really targeting resources to families that need them, to literally lower families that need additional help. In my own case, my wife took a 1-year maternity leave that lasted 12 years because we made the choice, and she made a great sacrifice professionally. We made a sacrifice financially that was what was best for our kids, but we had the ability to do that. A lot of families don't, clearly. So we're most concerned about people that literally don't have the resources to get the child care they need. Could you tell us what kinds of options we should be considering to make sure we direct the dollars we have where they are most needed? And that tends to be, I would think, lower income families, particularly single moms, situations like that. What are the kinds of programs we either have that we should be beefing up, or maybe even additional programs that we should be considering?
There's only 1 second left. Should I answer or?
Yeah, go ahead and answer the question,
Okay.
and then that'll be my last one.
Yeah, so I think that all of the witnesses are experts on this. There are many children who, I think what needs to be done is there needs to be careful analysis of the data around CCDBG vouchers, TANF subsidies, to identify the children who are in the low income, often single parents, it is in our interests to have their subsidies high enough that they can afford the kind of childcare, those families can afford the kind of childcare that wealthy families pay for their children. That to me is something that's worth focusing on. But that's a whole different topic, and it needs, we need to look at the data that exists very carefully to figure out who those children are. But I would say starting with the families on TANF, if we were simply to get those families into high quality childcare, that would be a game changer, I think, for those families.
Thank you. Congresswoman Roybal Allard. Congresswoman Roybal Allard? I just saw you. There you are. No, that's Catherine. Congresswoman Roybal Allard. Then let
Madam
me.
Chair, she has been having some technical difficulties.
Okay, let me go next to Congresswoman Barbara Lee.
Thank you, Madam Chair. This is such an important hearing. I want to thank you and our ranking member for putting it together. Let me just ask our witnesses, and thank you all so much for being here, but I want to find out, what are the long-term structural issues that bring us to this point once again? I share my personal story. In the 70s, I needed childcare, raising 2 small children as a single mom. I started college as a freshman, of course, and the line was so long, the waiting list, I didn't get them in childcare for 2 years until I was a junior. And the costs of childcare then were so expensive. I barely could afford it. My children went to school with me. They know statistics better than I do because I had to sit them in class with me. So I'm trying to understand the big picture in terms of why we're here still, when I know for a fact I was going through the same issues that women are going through now, especially women of color and low income women. And then secondly, just let me hear what the legacy of undervaluing childcare work done by our women of color, what that means long term in terms of maybe Social Security, in terms of stability of their families, and just what does this mean in terms of their life as we do not value their work by paying them what a decent living wage should be. Anyone who can answer, Melissa?
Sure, I can go ahead and take a stab. I think that the big structural argument that we're talking about here, and Dr. Hawley touched on it as well, is that we treat childcare as a private responsibility for every family to struggle with on their own. And long-term structural racism and sexism means that it is women of color, both as providers and as parents, that are struggling the most. In reality, childcare is a public good. It's critical infrastructure to hold up our economy, because right now parents are paying unaffordable sums, providers are earning poverty level wages, and that is the business model that we are operating on in childcare, because we have historically undervalued care work precisely because of who does it: women, and disproportionately Black, Indigenous women, and women of color. And so I think that there's a long history all the way back to enslaved women, Black women caring for the children of white landholders, all the way up to intentionally excluding domestic and care workers in the Social Security, in the New Deal programs, all the way up to TANF, and talking about the ways in which we're not adequately supporting low-income single moms. And so this is a long arc, it's a long history. And when we come to this day and this sort of inflection point in the pandemic, where we're finally seeing care and the work of the women who are doing this, doing the caregiving as undergirding our entire economy, I hope we can make a different choice.
So shouldn't anyone else could respond to that? Because it seems like we should also at the same time be looking at these structural issues, because otherwise it's going to be another 30 years and we're still going to be at the same place where we are now, where I was in the day.
And if you don't mind, I would just like to add to what Melissa said. All of that stuff is true. And I think if we continue to situate the childcare industry rightfully in the history of childcare, then we'll start to understand some of these issues. But I also want to reference what Catherine said as well, because one of her concerns that she cited was that we are going to be institutionalizing childcare. And the problem for this country historically has been that we are very comfortable institutionalizing Black and Brown people in the prison system, but not in the systems that actually will transform their lives for the better.
Well, thank you very much, Madam Chair. Anyone else? I have 50
Sure.
seconds left.
Yes, so I think an interesting analogy here is thinking about public transportation. Like people pay their fee for the to get on the subway, and we might give some subsidy to them to get a reduced fare card or something like that. But what we're not looking at is like that whole transportation system is undergirded by a public investment, so it's there in the first place. And we recognize that the cost of that system is more than anybody is actually able to pay on their own. With childcare, we don't do that. We base how much childcare costs on how much people are able to pay. And it doesn't match up to the cost of providing really good, high quality care. We need an investment that undergirds the entire industry so that it's there for all families and is able to provide the quality that children deserve.
With the 1 second, Barbara, with the 1 second, I would just say in the same way that we're dealing with the airline industry. We undergird it, we do that, we understand the problems, and we respond and we act. And we do that both for the industry and we do it for the workers. That's not the case with childcare. So great question,
And we never have,
Barbara.
but we never have.
Well, it's true, but well, Congresswoman, I'm sorry, Congressman Harris, I'm sorry to take your time. You've got plenty of time, so they will unmute you, I think. There you go. Okay.
Thank you very much. And, thanks for the timely topic, discussing a timely topic. I have a question for Ms. Stevens. A lot of the issues, some of the issues revolve around children having to be home from school. So having virtual education from home. We now know that it's safe to be back in school. We've always known it was safe for the children to be back in school. That was even known last spring, early last summer. But now we have data. We have data from months and months of school systems that have remained open. So my first question is, wouldn't getting us back into school mean these children back into school also relieve some of the burden on the child care system? And the second one is, if schools are not going to reopen, couldn't we alternately in order to get, again, to free up the ability of some of those parents to go to work, couldn't we also offer school choice more broadly so that you have a choice to actually send your child to a school that does remain open during the pandemic? So those are my two questions for you.
Thank you for those questions. I think there's quite a lot of evidence that parents' enthusiasm for school choice has been growing a lot during the pandemic, because there is what you've just said is occurring to them. And yes, if we were to open schools, if more schools were open, that would make an enormous difference for parents going back to work. And obviously, if parents could send their children to a school that was open if they wanted to, that would also help. I worked for 10 years in the New York City, I ran a not-for-profit that worked with New York City Public Schools. Those two things are going to be hard to pull off in the time frame we're talking about. That's just the reality of it. I mean, certainly the school choice issue is I think the pandemic has given a lot of momentum to that. But it is not something that can be done as a solution to the pandemic, I don't think. And knowing the New York City school system the way I do, I'm not sure. I think this problem is going to be going on for quite a long time. There are wonderful organizations, I wrote a piece on this recently, that do after school programs. And if we were to give them funding to expand to school day programs. That might be a solution for especially large urban areas that I think it may be a while before we see the schools open.
And let me just follow up with that. So in those urban areas, these after-school programs, some of which could be educational in nature, actually, I'd say would be a twofer, because not only we enable parents to work outside the home, but we also enhance the education of the children who are left furthest behind. And
Yes.
honestly, I think what the COVID pandemic is going to show us is that the children who were furthest behind at the beginning are
Yes.
even much further behind at the end. So going forward as a policy issue, wouldn't this make sense as a way to kind of make up for the time lost during COVID?
Yes, I mean, I know in New York City, some of these not-for-profits ran summer schools where children gained more learning over in going to these summer schools that weren't regular school than they did the whole year. I would be happy to send you with the information that I have on that. I think that would be a win-win for the kids and obviously for parents who need to go back to work.
Sure. No, and no, thank you for your testimony. And Madam Chair, I'll yield back the balance of my time.
Thank you. And let me recognize, Ms. Roybal Allard is not back yet, so let me next recognize Congressman Pocan.
Great. Thank you very much for that. And, this hearing's been very helpful. You've brought a lot of really strong points together in one spot. And I want to thank both our chairperson and Catherine Clark and others who've been such strong advocates for childcare for years while I've been on this committee. And I love the work that makes work possible line. I'm definitely going to remember that because that's very helpful. And care infrastructure. Also, this is really important as we're talking about infrastructure and what this means. I think one of the things that was most surprising was, Ms. Goldberg, when you talked about 80% of the businesses remain closed right now. And as someone who's been a small business person for over 30 years, it's hard to try to start that back up from nowhere. Do you have any recommendations how Congress could perhaps be helping in that way too? Because I'm afraid, restaurants have kind of gone to takeout. You can't do that with childcare. When you look at some of the industries that have found ways to partially make up for it, you don't have that here. And to reboot could be more difficult without some additional assistance. Do you have any thoughts on that at all?
Nothing cures poverty like money. We are poor. The industry is poor. We have been languishing in poverty for a very long time. And I just want to clarify that 80% of the license exempt program that serves primarily school age children are the ones that are closed.
Okay.
And so, I mean, the argument for me is a really very basic and simple one. As a business person, you know that you're not going to stay open and operating if the margins are not correct. And if you're not going to make a profit and you're going to endure a loss every year, then there is no point in being in this business. For many years, childcare providers have been making that personal sacrifice, and COVID has basically just pushed them beyond the brink, where there's no more money in the kitty to keep this thing going. And so what we need is an immediate infusion of cash. We cannot continue to charge parents to use a service that we do not that they're not using. We don't have it in our personal accounts to do it. And so the only place that can step in to fill the gap right now is the federal government. And without sustained efforts to ensure that this remain a critical part of our infrastructure, we are going to be back in this place again. As a business person, we are all business people here. We do love children, we are educators, but at the end of the day, it is still a business and you need money to continue to operate a business.
Yeah, we have a friend who currently isn't doing her home-based business for younger children just because of the current situation, and it's, having a big impact. I'll never forget when I got stopped at a grocery store when we did the Affordable Care Act. When it finally got implemented, I had a provider who takes care of children in her home crying, saying, "Thank you. I can finally have health insurance for the first time." So here she is running the business and never even had health care for herself until we had that in place. The thing that we often hear about too is just we're caught in between this extremely low wage, difficult business, and then the cost of childcare for some makes it impossible for people to be able to take advantage of that in some ways. That's another part of what I guess I'm curious on how you can recommend moving forward what we've learned through this pandemic, like we've learned the importance of things like broadband. What have we learned about helping so that anyone who needs to be able to go to work has the ability to have their child in a child care environment? Is there anything that we can take forward from here?
I think what was wonderful about the crisis is that it stripped away all of these barriers and regulations that allowed state. I have an amazing commissioner, Beth Bai, who used the opportunity to just basically, with the resources that were finally coming into the industry, to put in place those systems and those innovations that we needed. And one of the things that all in our network meeting, our circle network meeting, which is one of the 12 staff family childcare network that the state was quickly able to ramp up to support those very vulnerable family childcare business, was that they ensured that every single provider became a vendor of the state, and then they just made cut checks directly onto the program. Every single one of our providers reported that across the board, and we serve family childcare providers, group homes, and centers. And so every single provider heralded that as the biggest success of the pandemic. And when we sat enviously looking at Illinois, they paid their providers $25,000 a month. If we had $25,000 a month, we would be able to remain open, keep all of our staff, and be there and available for parents. The federal government is the only entity that can step in to do that.
Great, thank you. I yield back.
I would just say that Commissioner Bai is extraordinary, as Dr. Hawley is extraordinary in the states in which they have really tried to address this system. And with that, please let me recognize Congresswoman Jamie Herrera Butler.
Thank you, Madam Chair, and thank you all. This is an issue I've been working on since before the pandemic. I have 3 little boys outside right now on the trampoline. My husband's shoveling snow off. They're our co-op, like we're sending them around to each other because there was no preschool this year. And then my 7-year-old is on her e-learning thing, and I don't know where the maybe is. I'm just hoping she's cool. um, Before this, I introduced bipartisan bicameral legislation called the Child Workforce and Facilities Act, and it would authorize $100 million in grants to states where there are child care deserts. In my district and my state, we are a child care desert. I think we're the 6th most lacking in facilities and in providers. So there's a pipeline issue. There's physical space, then there's the provider space, but then there's also, what Ms. Goldberg has been speaking to, how do you stay afloat? The ones we have, how do we keep them afloat? And I think that Ms. Stevens' comments are really interesting as well. I look at, as I have done, roundtables and worked with our state chamber affiliation, because obviously this has such an impact on business and the economy at large. Like, so pre-pandemic, it was how do we fix this? And, we talked about training and then what it takes to maintain those employees. And a lot of those providers were really honest with me with some of the challenges, whether it was the hike in minimum wage and their ability to stay open. This is not an easy problem to fix here, which is why I think some advocate for a federally run system that's federally funded, that federally institutionalizes. And the one thing I really love are options as a parent. And I like the idea that we need to make sure that those who can't afford options, like a in-home or a higher quality center, or one that's more geared towards some kids, special needs, right? More wealthy families can do that. I would really be interested in seeing how we can bring the CCDBG more in line, that and the TANF in line with making sure that it allows an equalization among working class kids, to their peers whose parents make more money. Like I'd like then them to have the choice. Because I also wrestle with and agree that my kids are only young for a certain period of time. I have not, my husband has stayed out of work. We talk about all the women who are dropping out, to support the family. My husband has stayed out of work for me to do this job and to be home and not going to pretend like I'm a member of Congress and we're on the thin line. I can't imagine. I talk to working families in my districts where they're in the same spot and they have 3 and 4 kids and they're just trying to piece it all together. So obviously we have to do something. I really feel like that targets the middle income families who don't have the money to make it work and don't qualify for subsidies. And that's really, for me, the sweet spot. But I think we need to recognize, and I have some real misgivings about a giant federally institutionalized program, because the best years of your kids' lives, I mean, you only get them for what? Maybe they pay attention to you until they're 12, maybe. But these are those really, really special years where I want help and I need help and we do everything we can to piece it together. But I want to be their main source of learning, and I want to help speak to who they are and pull out their strengths and giftings. And so I want to be careful that we maintain choice in this. We maintain choice for families. If it means getting more money to families who don't have choice because they don't have access, then we need to look at ways we can do that. But I'm very concerned with the idea that the federal government and a big federal program is going to do it best. The one thing I've noticed with the airlines and with the prisons and with the roads is we've kind of screwed all that up. I mean, big time. I don't know that I want to do that with our kids. And maybe Ms. Stevens, if you could speak to that, and if there's time left, Ms. Goldberg, I'd also like to hear from you.
Yeah, I mean, I agree with your characterization of this. It's not clear to me. I feel as though the definition of what problem is we're trying to solve here is we're kind of all over the map with what problem we're trying to solve. So there's two questions. Question one is what problem you're trying to solve. The next question is what exactly is the nature of that problem and how to solve it. And to some extent, we're talking about different problems and different solutions to different problems. So obviously that's what you guys have to figure out. What Georgia was describing, makes perfect sense to me. I think what she's describing is an important thing to be addressing. I've read this legislation carefully. That's not what this legislation is aiming to do in my read of it. For example, the increases in the child and dependent care tax credit are a through the roof tax break for wealthy people. And I don't understand that. Once all low income kids are in very high quality childcare, okay, that's a separate question. But until that's happened, I just don't understand why we would make that choice.
What I'm going to do is, since Congresswoman, that you said if there was any time, I would just like to get Ms. Goldberg to very briefly comment.
Thank you.
The same piece. So
Thank you.
Let's do that. Thank you.
I appreciate that. I think we're trying to actually solve one problem, and that problem is high quality access to early learning experience for every single child, regardless of the setting that a parent chooses. I am Jamaican. We are culturally averse to childcare centers. We have family members that take care of our children. My sister made that choice to keep her child at home for 3 years, even though I have a childcare center and my mother works in a childcare center. I'm a Christian and we have a Christian program. And so we do not have like equal access to federal dollars to continue to offer the choices that families want. We are not asking to create an institutionalized system. We are asking for money to fund an early care and educational system that can be responsive to every single parent, regardless of the childcare option that they choose. That's what we're asking for. I do not want Black and brown children to be in a school system or the prison system that's going to produce really terrible outcomes for them, especially at the most critical time of their development. But if you starve the industry of money, programs like Hope will disappear. Family childcare providers will disappear. And what will be left are those institutions. So we are having these disjointed conversations because you have backed many advocates into a corner where we have to advocate for the things that we know that we're going to get, hoping that we can live to survive another day to advocate for the things that is needed for children and families. And so if we finally start to invest in the early care and educational system, where as a former teacher who basically came out of the educational system because I saw how it was harming Black and brown children, and enter into the early care system and saw the benefit that those Black and brown children were getting from the program. If I had the money to do more, we could radically transform the lives of Black and brown children and poor children and women and families. So that would be my response.
Thank you. And I can apologize to him because in the order I didn't get to him next, but you're on tap, Congressman Fleischman. But let me now recognize Congresswoman Catherine Clark, and as Congressman Pocan pointed out, someone who has been deeply, deeply involved in the entire child care a debate and how we can address it. Congresswoman Clark.
Oh, thank you so much, Madam Chairwoman, and thank you for being such a champion. And this has been a fantastic panel, which is really getting to the core of how we are going to rebuild a more inclusive economy after this pandemic. And thank you for the recognition that childcare is infrastructure and really is it's the underpinning for our economy. And I wanted to continue the conversation about choice and how we meet the needs of different families in different settings, in different parts of the country, and make sure that everybody has access to affordable, quality childcare. And I don't think we can really have that conversation without talking about who makes up the provider workforce, that this is also predominantly women. Here in Massachusetts, childcare providers are over 96% of them are women. And nationally, about 40% of childcare providers are women of color. And I think it has a large part, it is a large part of the explanation of why we see such low wages and benefits. And so I wanted to ask you, Mrs. Goldberg, what have you seen in your experience as a woman of color? How have you seen racial injustice permeate the childcare industry, and what steps do you think we need to do to address it so that we maintain this choice and diversity?
We could be here for 10 hours talking about
Yes.
this, but I'm just going to take a
We have
little
3
time
minutes to answer this question.
And I'm just gonna paint this picture. The public schools, which are made up in Connecticut of 90% women who are white, maintain their salary, maintain their benefits, got to remain at home, and had no fear about whether or not they were going to be ill or they were going to lose their income and their homes during this pandemic. The childcare industry, on the other hand, which are made up of about almost 50% of women, it's the only educational institution that is that diverse. We are here begging for scraps. That's the difference of institutionalized racism. When you are white, your issues are heard, it is understood, it is responded to immediately. When you are Black, you are here begging for scrap, for people to recognize your humanity. And that's what has been going on for years in the early childhood education system. The difference now is that we have understood with this pandemic how we cannot continue to ignore the cries of the childcare advocates anymore, because childcare is so interwoven into so many parts of our system. We were not going to be able to respond to this pandemic without a childcare industry. As a matter of fact, the reason why the the, the many parents were still able to keep their employment when the school shut down was because all of those children shifted in large part into the childcare industry. And so we have been there to respond, but even after we are here basically saying we need help, our issues and our cries are unheard because of the color of the workforce, and this would not happen anywhere else. The United States spends less than 0.05% of its GDP on childcare. It is the only developing country, first world country, that does that. We are cohorted with countries like the Czech Republic and Turkey. When has that ever been a good thing? No, no offense to Turkey and the Czech Republic. When has that ever been a good thing? And that only happens in industry that are predominated by poor, by women, and by women who are poor and are women of color.
Thank you so much for that answer. And, to Ms. Boteach, I'd like you to, in the brief time I have left, try and answer this too, and really address how this is so tied to how much of our economy is based on the unpaid or low-paid work of women, and in particular, women of color.
Thank you for that question. I think it's crucially important. I mean, as noted earlier, the airlines are looking at losses of $90,000, which is nearly half of what childcare has experienced. And no one is making the argument that the airlines are doing just fine. This problem has sort of uniquely, the lack of relief has uniquely targeted an industry where women are not over 90% of the workforce, and women of color are so disproportionately affected. And I would say that this predated the COVID-19 crisis. Inequities in the federal childcare system go back, again, all the way to slavery in America. And I think that when we look even today at the legacy of that, it is African-American parents, Latino parents, Native American parents who face the most barriers to affordable, high-quality childcare. It is African-American and Hispanic workers who are more likely to be relegated to lower-level positions, even within childcare programs, even when you account for educational levels. So, for example, African-American early educators are typically paid 78 cents less per hour than their white peers. And so it is crucially important that as we rebuild and that as we move forward, that racial and gender equity is at the center of the system, not as sort of a sideshow, but something that is intentionally baked into every policy decision that we make.
Thank you, Madam Chair.
Thank you. And I see Congressman Fleischman. Let me recognize you. My apologies for not strictly going in seniority a few minutes ago. Congressman Fleischman.
Well, thank you, Madam Chair and Ranking Member Cole. It's great to be back on this wonderful subcommittee. This was one of the first subcommittees when I became an appropriator I was privileged to serve on, and look forward to working with my friends and colleagues on both sides of the aisle. So I thank you. Dr. Stevens, some of my constituents have come to me and said that remote learning is negatively impacting the emotional and mental well-being of our students. They also claim that it has the potential to stunt their academic growth. In my previous efforts on this subcommittee, I have worked in conjunction with colleagues across the aisle and with outside stakeholders to provide STEM education. Opportunities to rural and low-income communities have clearly been affected by this. Many of these STEM programs require an in-person lab class. While teachers are doing their best to adapt during these difficult times, there are some learning experiences that cannot be replicated virtually. Moreover, a recent study shows that 30% of all K through 12 public school students live in homes without proper internet connections and without suitable devices for at-home learning, making the attempt to stimulate the hands-on STEM experience even more difficult. My question is, can you speak to some of the financial challenges disproportionately facing low-income and rural families, and how outdated and anecdotal evidence, as mentioned in your testimony, impact the policy seen before us today?
Yeah, thank you for that question. I actually did a webinar a couple of weeks ago with two teachers and two administrators on teaching in the pandemic. They talked about what it was like to teach on video all day, every day. It's very difficult for the teachers. What you're describing in terms of the students that they are serving are fall into the category of students you're describing, who many children do not have the support and the technological resources at home to enable their effective participation in remote learning. Also, as you mentioned, the impact on children's emotional well-being, it seems pretty clear that it's having a negative impact. Because the schools are controlled by the state and local level, I really don't know how quickly we'll be able to address this problem nationally. If we're thinking about what we could do in the meantime, I mean, we can continue to support states and localities in opening their schools. England has just launched a really wonderful national tutoring program. There are a couple of states in the US that have launched tutoring programs for kids. I think that is worth looking at. I think that, as I mentioned before, looking at figuring out how to bring high quality after school organizations on board. I think that makes sense to look at, while at the same time continuing to work with states and localities to figure out what they need to open. As you know, the federal government just doesn't have very much control over schools. So I think that looking at supporting other kinds of solutions may be also worthwhile.
Thank you, Doctor. And Madam Chair, I see I've got under 40 seconds left, and I know there's a lot of folks wanting to ask questions, so I will yield back the balance of my time, and I thank you.
Thank you, Congressman Fleischman. And with that, let me recognize Congresswoman Frankel.
Thank you, Madam Chair. Thank you, everybody, for a great discussion to the panel. So I think I bring some common sense to this because I was a working mother and now I'm a working grandmother. And I will say that both as a working mother and a working grandmother, I do always look forward to the nap time. And I say that because, listen, taking care of children is a 24-hour job. It is not just 9 to 5. And so, just with all due respect to one of the panelists' comments, I think that it is happy, fulfilled parents that are best for children. And hopefully we're not at the point where the government decides what will make a parent happy and fulfilled. So I really think for this discussion, the first question is, what's the public interest in having a good childcare system that is equitable? And that is, I think, I've heard a lot of reasons today, including the well-being of children and the need for our economy for parents to be able to get to work. And I don't even think the issue is why we are having what we call a she session. I mean, the fact of the matter is, whether somebody is out of work because they don't have daycare or whether they are out of work because they don't have a job, we are going to get to a point where hopefully people will have jobs. And if the childcare industry is decimated, they're not going to have childcare. And so I think this is a very, very important issue. And just to say, and I know Brenda Lawrence can confirm this, the Democratic Women's Caucus will make childcare at top of our priority to make sure that this industry is stable and fair. I also want to say this. Child care workers should not have to be on food stamp. And I do want to ask, I'm going to ask this question in terms of the pay for child care workers. And that is, how does the low pay impact the turnover, for example? And what are your specific suggestions on how we up the pay for our child care workers? And then finally, before you answer the question, I want to just say this. Again, common sense approach. For parents to go to work, you need a job, right? And what's the second thing you think of? What am I going to do with my children? And you actually think about that before you say, what's the road like? What's the bridge that I'm going to have to go to get to work? And so childcare has to be part of our infrastructure. With that, I yield to if someone answer my question about the low pay and the turnover. Ms. Boteach, I think you're shaking your head. Go ahead.
I was going to say, I mean, I'm sure Georgia can also speak to that, but I mean, right now, childcare workers on average make less than $12 an hour. And as I noted in my testimony, over half need to turn to some form of public assistance or support in order to make ends meet. And so if providers are having trouble making ends meet in a job, not only are they more stressed, not only are their families more stressed, but there's more turnover in the industry because people don't see a stable job that has long-term growth for them. Childcare providers are exhausted. They have been the heroes on the front line, sacrificing so much, not only during the pandemic, during which, I mean, they've been on the front lines, but before that, they've been holding up our economy on their shoulders for poverty wages. And I think this pandemic has laid bare those inequities and it's exacerbated them. And we have a choice going forward. We don't do this on the cheap. We can't do this without big federal public investment for the very reasons that you said. Childcare is infrastructure. Childcare is education. Children's brains develop most quickly between the ages of 0 to 5. It's in our interest to make sure that they are in loving and high quality settings, whether that's at home or whether that is in a center. And so this is a public good, like K through 12 education, like roads and bridges. And we have been investing in it or disinvesting in it as though it is not for a long time. And yeah.
Yeah, Frank, a quick question. COVID and childcare, what is, can someone comment on that?
Sure. We have found that childcare providers are really great at infection control. It's part of the everyday work that a childcare provider does with young babies and young children. We found that children really are safe in a well-run childcare center that is using all the health and safety guidelines and are able to operate safely even in the pandemic. So we've been incredibly proud of the way that our providers have stepped up, implemented these new health and safety guidelines, and kept the children in their care safe.
Thank you. Yield back, Madam Chair.
Mr. Molinar? I think he may have had to leave, and it's my understanding that Congresswoman Roybal Allard has lost the internet connection, you know, and she's struggling at her end with that. If that can be redone, we will get Congresswoman in the mix. And I've just been told that Congressman Molinar is had to leave, as well as Congressman Harder, and my fault in not introducing Congressman Harder at the outset. I will call and apologize to him for that. But with that, Congressman Klein, you are recognized.
All right. Thank you, Madam Chair. Am I coming through all right?
You are indeed.
All right. Thank you. Chairman DeLauro, Ranking Member Cole, thank you for holding this timely hearing. I'm honored to be joining the Appropriations Committee to ensure that taxpayer dollars that are allocated by Congress have proper oversight and accountability. And coming over from the House Education and Labor Committee during the last Congress, I'm proud to be able to continue to work on these important policy areas in the Labor HHS Subcommittee. As we all know, COVID-19 has significantly alter the daily lives of millions of Americans. This is clear, most notably when it comes to childcare. We need to, as we get the vaccine rolled out, we need to open up our economy, get folks back to work, get kids back to school. But that, as evidenced by the conversation that's been happening over the course of this hearing, has to happen in a specific order. You can't just open up an economy and have folks go back to work if there's not availability for the kids to either go to school or have childcare available. Different states have different economic challenges facing it when it comes to childcare, when it comes to schools reopening. What's going on in Virginia right now is very different than what's going on in New York or Connecticut or out in Seattle, Washington. My colleague, Congresswoman Herrera Butler, was talking about childcare deserts. We have challenges in Virginia, but because we have maintained a lower level of regulation on the childcare industry, it's not as challenging to start up a childcare business. It's not as challenging to operate a childcare business. Now, in COVID, it definitely is, but state to state, you're going to have different levels of regulation, and those are going to create different challenges for the industry and for parents, for pricing, for options, for choices for those parents. So as Dr. Stevens has mentioned, the solution to childcare may be more aligned with school openings than with drastically increasing federal funding or a federal role for childcare. And while relief aid is important as appropriators, we must ensure that funding is going to where it truly is effective. And we shouldn't head down a path that allocates taxpayers' hard-earned money to programs that won't effectively relieve the most pressing and devastating impacts of COVID-19 on our communities right now. So Dr. Stevens, as you mentioned in your statement, the child care provisions in the rescue plan appear less as a response to effects of the COVID-19 pandemic, but rather a massive scale up of government spending on non-parental out-of-home care for young children. And as you stated, proposed new spending would bring the total spending to address this to almost $59 billion, which is 1.7 times total public spending on early care and education. Can you expand upon how this funding level might have been determined, what factors may have led to any inaccuracies, quite frankly, in analyzing the need for it?
Yeah, thank you for that question. I think that the problems that the other witnesses have been bringing up, Georgia has been describing these problems. Those are real problems. There's some different problems squished together in there. So you're talking about very low income, Black and brown people who have inadequate access to childcare, say. Then you have much wealthier people who can pay, they just would rather not because it's too much money. So there's a whole bunch of issues being squished together in this. Not to say that they're not important. However, if they are big picture issues that are not directly related to the pandemic. I also just want to make one point. The Bipartisan Policy Center did a fascinating survey of parents in December. 1/3 of the women respondents said that their ideal childcare arrangement was to stay at home and to raise their own child. 1/3. On the other hand, there's a big division in this by education and income. So among parents, men and women, earning over $75,000 a year, 59% describe out-of-home non-parental childcare as their ideal arrangement. Among families who earn under $50,000, only a quarter say that. So this assumption that everyone's ideal is out-of-home childcare is just not true. And I think that that's something that we need to take a step back and decide on what the goals are, or we're not going to know what problem we're trying to solve.
Thank you for that question. I'm also glad to see that my colleague found the baby. I yield back.
She was totally safe.
That's very good, Jamie. She's back. And speaking of being back, Congresswoman Lucille Roybal Allard, yes for technology. Go for it, Congresswoman.
Okay, thank you. Let's see how long I can stay on. Ms. Boteach, I represent the 40th Congressional District of California. And it's a district that is distinct for its having the highest percentage of Hispanic residents in the country and one of the highest number of immigrants. In 2019, CLAS published a report about inequitable access to child care subsidies. In that report, it stated that access to child care development block grant funding varied considerably by race and ethnicity, with Latino and Asian children having the lowest rates of access nationally. Policy further exacerbates disparities in child care subsidy access. Given the demographics of my congressional district and the fact that approximately half of all Latino children under age 13 are members of immigrant families, it is no surprise that access to affordable child care is a particular problem for my constituents and other Latino and Asian families. How do you propose that CCDBG dollars be allocated equitably to reach the most vulnerable providers and families, particularly in communities of color where there have been historic underinvestment?
Thank you for that question. First note before getting to the CCDBG answer, I want to note that 1 in 5 childcare providers is an immigrant. And so from the provider perspective as well, recent attacks on immigrants in the past administration or, fear in communities has caused great stress on that workforce, understandably. And so I really appreciate you drawing the connection between childcare policy and immigration policy more broadly. On the CCDBG question, I think that there is a need to do greater outreach by language for children with disabilities, for underserved populations, to make sure that home-based childcare providers, friend, family, and neighbor care providers, and other kinds of providers that tend to be in areas or tend to be the preference of lower income Black and brown families are getting access to the subsidies and also getting access to the services that CCDBG provides. One challenge here is that CCDBG has been and continues to be so chronically underfunded that only 1 in 7 eligible children in all are getting access to a subsidy. And so I think that it's really important when we think about rebuilding the system to have a both and approach. The first thing we need to do is to make sure that there's adequate funding. And that's one of the reasons why we're encouraging not just the relief and stabilization, but also in considering FY22 appropriations to really increase and robust investments in the Child Care and Development Block Grant. Then once we have money and resources, it's also critical to think about how you intentionally do outreach, how you intentionally engage home-based providers that maybe don't have the same level of information as center-based providers to make sure that those dollars are actually reaching them. And so I think it's a both and. I don't want a world in which childcare providers are scrambling over the crumbs of a system that has been broken for so long. I want a world where we see that we have the resources to invest in the kids and that the policies then within those resources can make sure that they're appropriately targeted and putting racial and gender equity at the center.
Thank you. So I think you've covered some of it, but are there any specific programmatic or structural changes that we need to address in order to increase the number of eligible Latino children who receive the CCDBG subsidies for childcare?
I think the main issue is that the program has been so drastically underfunded that there's very small percentages of children across the board that are getting childcare subsidies, and Latino children are again amongst the worst of the percentages getting the subsidy. And so the main thing we need to do is to dramatically expand investment in CCDBG in our public and our childcare system more broadly. And then within that, to really think about how are we reaching out? How are we making sure they're linguistically appropriate services, culturally appropriate services, that we are making sure that immigrant providers have access into the same systems that everyone else does. And those are all steps that we can take in the design of programs, but that they'll continue to be constrained until there is actually funding to do all of those things. Set.
Okay. Congresswoman Bustos.
All righty, thank you, Madam Chair. I'm going to direct my question at my fellow Illinoisan, Dr. Hawley. As you know, it's not just Illinois, but all states throughout the country are facing this terrible problem with child care providers because of COVID-19. Governor Pritzker was kind enough to come to my congressional district last year and stop at a place called Skip Along. You're probably familiar with it. I'm a big fan of Skip Along and all they do to help our community. So it is one of the larger childcare providers in the Quad Cities, which is where I live. And I know you're familiar with it, but just to share a couple stats, they went from serving 1,000 children prior to COVID-19 to 50 back in March. Now, obviously, and thankfully, they've moved closer to full capacity. But providers like Skip Along won't be able to be fully back to normal really until the vaccines are widely administered. So, this impact has just been so tough for childcare providers wondering if they're going to be able to keep their doors open, for parents wondering how they juggle their careers and their families, and just all of the challenges with that. So let me go on record saying I am proud of the Pritzker administration. I am proud of you and how you've been able to use state and federal dollars to take this issue on directly. And that's why you were invited here today to share your successes. I want to ask you specifically how the Illinois Child Care Restoration Grant is helping providers and families in Illinois. And just to drill down a little bit deeper on that, what do you see coming up next for the Child Care Restoration Grants in order to meet the needs of the providers and our families? And how are you looking to improve that program? Let's start with that, if we could, please.
Well, thanks so much. I want to say that that all the conversation here today, our challenge with the childcare industry right now is probably less one of that there isn't enough childcare out there right now for families who are going back to work. The challenge is the childcare providers that are out there right now are not getting enough revenue. They are under enrolled. They are dramatically under enrolled. And that has to do with families who are working at home and is sort of unnatural, like we all are right now, and maybe are having their kids there home with them. There's lots of families are not choosing to put their kids in childcare right now. But when we're able to open up our society and everyone go back to work in their sort of more normal settings, people are going to need to have somewhere to go. And if their childcare centers have been financially ravaged by a lack of revenue for a period of a year or more, they're not going to be there for families to be able to use. So you asked what's sort of next with the child care restoration grants. We need to keep it going. We used all the resources we could and really help support providers, but they still need that help. And we have kind of calculated out that the money that we received in the last relief package won't even get us to the end of 6 months in terms of providing the relief that providers need in order to be able to keep their staff on board. The staff that they've worked so long to build, Skip Along is a great example of a place that invests in their staff, helps them complete college degrees, helps them get the qualifications they need. We can't afford to have them leave our childcare workforce. We need to keep them engaged in there. And so we are planning to continue to invest in the restoration grant model, providing direct relief to providers. Something we haven't been able to do as much is investing in the childcare workforce more, and we want to be able to do that with the funding, as well as some of our licensed exempt providers that we haven't been able to provide the necessary relief to, and we're looking at that, how we can support them. So if you send the states the money, we will find ways to use it well to support this industry that so critically needs it.
I would just say to my colleagues on this hearing today that what Dr. Hawley is doing and what the Pritzker administration are doing really can be a model. And again, Chairwoman DeLauro, I know that's why you invited Dr. Hawley to be with us today, but I do want to point that out if you're looking for a good model. Since I've got 40 seconds, I'm gonna follow up with one other question, Dr. Hawley. So an interesting data point that we've seen coming out of Illinois is that parents with the youngest children, so the children under age 1, aren't returning to childcare. And wondering what you think's going on with that and what we can do to address it.
So I think the operative word there is returning to childcare. I think the older children, they were in childcare and their families were comfortable with it. And when you think about going back, that's to a familiar place, and they're able to, even if there's a little nervousness about COVID and all of that, it's a familiar place and they have that trust. If you just had a baby and in this sort of strange time that we're living in, it's a little more nerve-wracking to bring your child into care right now. We know that we're going to have to invest in outreach to parents to help them understand that it is safe for them to use these services, use our preschool services. Even early education is way down. So we need to be able to invest in reaching out to families and doing that kind of parent engagement.
Very good. Thank you, Dr. Hawley. Chairwoman Delora, I yield back.
Thank you very much. Congresswoman Watson Coleman.
Thank you very much, Chairwoman. Let me thank my colleague, Catherine Clark, for revealing or having discussion about something that I find very important. This pandemic has revealed institutional racism in just about every aspect of our living in this country. And so we're very concerned about this particular industry, how it impacts our future and how it impacts our families right now. And I agree that we're in a crisis situation and we need to lift up and gird up and protect this industry so we can get through this pandemic. I also am concerned about how do we repopulate the industry. To what extent are we giving direct subsidies to families to be able to afford to send their children back into early childhood education? Because I also know that there are families who are totally unemployed but need to look for jobs, and they need access to high quality early child care, education and child care. I know that the evidence suggests that early education is vitally important to both our economy and to the future as it relates to our children. So I'm very interested in the discussions that we might have regarding the kinds of things that the federal government ought to think about moving forward beyond this pandemic, as what is it that we need to sort of ensure that the public good of early childhood education is supported, that those who are working in that industry are paid a fair wage and have access to Social Security and other pension benefits, and that those families who are financially challenged have access to the same high quality early childhood education. And with that, I would yield to, I'd like to ask Ms. Boteach first, and then anyone else who would like to respond to that issue. And Madam Chair, that is my only question.
Thank you so much. It's a terrific question. And the way I've been thinking about the various opportunities to respond to this crisis during this year is of thinking of the childcare system or sector as a patient right now that's in crisis. And the first thing we need to do is to stabilize the patient. And so that is the American Rescue Plan. That's making sure that we're getting money in to make sure there's a childcare sector to come back to. But then we have an opportunity, immediately, this committee has an opportunity through the FY22 appropriations process to really start with the rehabilitation. And so that means a dramatic increase in the Child Care Development Block Grant. I would also add in other early education programs like Head Start and Early Head Start and all those other programs that this committee oversees as well. But focusing on childcare for right now, a robust increase there is, number one, going to allow providers to be able to spend down the relief money as strategically as possible, knowing there's not going to be a dramatic cliff if they're trying to bring workers back in or they're trying to make investments about how they're going to be there when the economy reopens. So that's really important, both to make sure the relief money is spent as well as possible, but also to begin thinking about, okay, what have we learned during this crisis? We've learned, and I keep saying it because it bears repeating. If we take one thing away from this hearing, care is infrastructure. Care is a public good. And so if we are going to build that infrastructure, let's start with what this committee has jurisdiction over and make robust increases in the Child and Development block grant. And then finally, I think that we need to really think about what does the long-term system look like? There's you can't really separate access, quality, accessibility. All of these things interact with each other. All of them are an investment in children. When you invest in the childcare workforce, you are investing in children. And so I think it's really important to think about long-term as we're building a system where parents have choice of different kinds of settings that are culturally appropriate and high quality, where providers are being paid a fair wage with benefits and career ladders, where you have building supply, particularly in childcare deserts, where the populations that are most underserved tend to be rural areas as well as communities of color. When you put all of those things together, you're asking for a robust investment over many, many years. And the cost of that are nothing compared to the cost of inaction. Because when we don't act, we are costing our economy $57 billion a year, according to Ready Nation. That was pre-pandemic. That number has grown. And so when we think about, we can pay for this one of two ways. We can pay for this through lost wages, family suffering, businesses having retention issues, and just a lot of stress and economic pain, or we can invest and have a pathway where we actually have affordable, high quality childcare that's accessible for all.
Thank you. I yield back. Your answer was very comprehensive. So I didn't get a chance to hear from others, but thank you very much. And thank you, Madam Chair.
Thank you very much. Congresswoman Brenda Lawrence.
Thank you so much, Madam Chair. I represent the city of Detroit, and according to a recent report by the National Women's Law Center, it concluded that 6 in 10 women of color are experiencing difficulty homeschooling, including a portion of the respondent describing insufficient child care coverage. While predominantly Black neighborhoods tend to have more child care providers, my hometown of Detroit is an outliner. It has a vast child care desert. And as our economy continues to recover, this could pose a major issue for many of my constituents. So my question is, Dr. Hawley, can you speak to how Illinois has addressed child care deserts, especially in communities of color? And what advice would you give to other states? And I just want to say, in conjunction with my co-chairs and Lois Franco is here, we must invest in an infrastructure, social infrastructure, to improve the quality of life and equality for women in America. And I feel strongly that this is one of them. And when I speak passionately about the community of Black women, we have so much to do. So what can you recommend for those communities that, I would put my child in child care if I could afford it, but I also would put one if it was one available in my community?
Yes, this issue, thank you for the question. This issue of childcare simply not being available in so many communities is so important for us to be looking at. In Illinois, we have included early childhood education and care facilities in our state infrastructure plans. When we do a capital bill, we include, in this last capital bill, a record $100 million dedicated to facilities for early childhood. And we've done that because we know that there are so many communities around our state that simply do not have the facilities that they need in order to be able to care for young children. It's not facilities alone, though. It's the program and the programmatic money. We are going to be investing in, with our GEAR funding, with our CCBG funding, investing in communities and helping communities do the planning that they need to do to be able to open new settings and new programs for young children and families in their community. We have to invest in the data systems that help the state identify where the needs are. We have to invest in the communities to do the planning that it takes to be able to open this. And we have to invest in the bricks and mortar to open a child care center. It's not an easy thing to do.
You're driving home a point that I and the Women's Caucus are going to be really pushing. The fact that Illinois invested in the infrastructure of childcare. We must improve the workforce. We must compensate them. But if we don't invest in the infrastructure of childcare, we won't achieve our goal for so many communities. And lastly, I just want to ask Dr. Boteach, do you have any recommendations on how we can increase the labor workforce for childcare? I had a wonderful opportunity to travel to Japan, and they have elevated childcare where you see young men choosing that as a career. First of all, they're compensated. Second of all, it is a respected profession. Can you speak to that?
Absolutely. I think you hit the nail on the head. It's when you respect something, you don't expect that they're going to hold up the entire economy on their shoulders without fair pay. And so I think crucial to this conversation about attracting, but also retaining a workforce in childcare and early education is treating them like the educators that they are. And children's brains are developing at their fastest rate between 0 and 5. Childcare is education. And so when we treat childcare providers as the heroes that they are, but pay them like the heroes that they are, with fair wages, benefits, taking their safety. In some states, they haven't even been given the vaccine at the same rate as public school teachers. And so what does that say? They are open, they are operating now, putting their lives and health on the line. And in some states, we're not even in the top of the pack to get a vaccine. And so when we start respecting this profession, when we start paying fair wages, benefits, and having career pathways, you're going to see a lot more people coming into the profession and staying there, because every childcare provider I know loves kids. They love that job. But they're also deeply exhausted. And so I think that we need to show them that respect.
Thank you, and I yield back.
Thank you very much. And it is after 12, but we are not going to be able to get to a second round. But this has been an enormously really very, very productive, the richness of the content and the contribution by all of our panelists today, and the very substantive questions and concerns demonstrated by members. So to you, Dr. Stevens, to Dr. Hawley, to Georgia, and Melissa, thank you so much for what you bring to the debate. And even if there are differences, the ability for us to examine this issue in all of its pieces, I think, is critical for all of us. I'm going to ask Congressman Cole to make some closing remarks, and then I will, and then we will bring the hearing to a close. Congressman Cole.
Thank you, Madam Chair, and I want to associate myself with your remarks. I thought this was an excellent hearing, very appreciative of all our witnesses and their perspectives, very informative testimony. It seems to me that the challenge we will have is just simply targeting this. I don't think there's a big debate that we need additional assistance in this area for the child care industry. There's obviously what's the right mix for getting our schools reopened, what's the right mix for making sure that people that want to send their kids to supervised daycare and with quality, so that they know their children are not only being looked after, but are having the opportunity to grow. And finally, and we didn't talk about this too much, but a piece of this to me is homeschooling, or making parents that want to be able to stay at home, something that Ms. Stevens talked about. And there's evidently a difference with different socioeconomic groups as to how they view that. We didn't really get into that, but that's an important thing for us to consider as well. I thought my friend and our colleague, Ms. Herrera Butler, made a really good point talking about options. How do we create options so that parents can actually do what they think is best for their children, and not be limited by circumstances. So I know we'll be wrestling with all these questions in the weeks and months ahead. There's never enough resources, and that makes targeting, I think, all that much more important. But again, I just want to thank you for the hearing. I think it's a really important topic, and I want to thank all of our witnesses, and I certainly want to thank our members. I think you could tell by how engaged everybody was. This is a real live issue for all of us because we hear about it at the grocery store or at church or at the civic club. I mean, this is very much on the minds of the people that we're privileged to represent. So again, thanks to you and thanks to our witnesses for giving us a really spirited discussion and I think a good look at a really important problem. Yield back.
I want to thank the ranking member for his comments. And if I might, please, I just want to, what I view as, you know, what we lift out of this, very, very rich discussion. COVID-19 did not create the childcare crisis. It exacerbated it, and it exposed the racial disparities with regard to providers, with workers, and to families. Childcare providers were already operating on razor-thin margins. Early childhood educators themselves were making so little that nearly half accessed public benefits, and the families living in low-income circumstances struggled, and are still struggling to gain access to affordable, high-quality care. I think the framework of child care infrastructure or the industry's infrastructure is a critical message that comes out of this. And I just want to make a point here that $60 billion for the airline industry, we believed it was necessary. We voted for it, for our economy to survive. Corporations have received $522 billion for PPP loans. That was critically important. We provide infrastructure, especially in these crises, for agriculture, for the auto industry, for Wall Street and the banking industry, for housing and mortgages for families. And when these industries are in trouble, we act. The Congress moves, and in a very big way, in real time. And yet, we, because of what has been said about undervaluing childcare and undervaluing the women who provide it or the workers who provide it. So that's where we need to move, to take this undervalued and under-respected industry and place it where it needs to be, at the center of our economy. Childcare, this is what Melissa told us, is the work that makes all other work possible. It therefore needs to be at the center of what we are trying to do. And the economy is not going to recover until childcare is back and that it is better. Whatever form it manifests itself, providing families, yes, with the choice that they need. And as lawmakers, we need to recognize that childcare is essential and it needs to be funded in that way. It is, it just, you've demonstrated really across the board of, you know, we looked at, and I will just say this, not that long ago, on the fringes, we talked about paid family and medical leave, that it was too far a stretch. Today, it is at the center of public discourse. We talk about equal pay for equal work for women. On the fringes, not that long ago, now central to how we move forward. And right now, the revenue and the resources for the childcare industry needs to have that central place in our discussion as we move forward. And again, just thank you all very, very much for your being here today, for shining the light on this. And you can tell, and I say this to, Georgia, Dr. Stevens, Dr. Hawley, Melissa, the women and the men who are on this call today understand that nature of what we need to do. You've heard from them, and you know that you have allies within the Congress to allow us to move forward. So I thank you very, very much. I also am going to beg your indulgence for one more moment. Final note, and I want to do this. It's fitting that the hearings on childcare, but it is the last hearing for a woman who has been devoted to this issue, my chief of staff, Letty Medeiros. She leaves today to embark on a well-earned retirement, though I cannot imagine Letty Medeiros retiring. She has been a confidant, a friend, a leader of the team for 12 years. Real results, not only for Connecticut, but for the country and for families. And early childhood and labor policy has been at the center of her work. Started on Capitol Hill in 1998, leading labor policy expert, raising the minimum wage, equal pay, paid sick days. These are the areas that she has been a champion of. Labor Director for the House Education and Workforce Committee under George Miller, Labor Director as Senate Help Committee under Patty Murray, before coming back as Chief of Staff. Letty grew up in Cuba. She came to the United States in the Mariel boat lift. She has fallen in love with the American West. We will miss her. Thank her for her dedication to public service. Wish her well. As I say, though, I can't ever imagine her retiring. And personally, I will deeply, deeply miss her. Just her ability, not just her ability, but her friendship and the closeness of our relationship. So I wanted to give her so much credit as we leave, and this is her last hearing. So thank you all again very much, and I'll bang on the table. This hearing is concluded. Thank you. Take care.